Hello and welcome. My name is Calliope. I'm a student nurse here, and I'm going to be performing your head-to-toe assessment. Would you mind just telling me your name and date of birth? Okay, very good. Do you know where you are right now? Okay, and do you know what year it is? Wonderful. My patient is alert and oriented. Very good. So, I'm just going to jot a few things down. I may refer to my clipboard once in a while, just so that you are aware. Okay, wonderful. And what is your reason for your visit today? Okay, very good. All right, so I'm going to be getting some vital signs from you. Firstly, we're going to be doing your blood pressure. Is there a particular arm that you prefer your blood pressure to be taken? Okay, all right. Okay, so I'm going to undo the cuff here. Good, and I'm just going to put this on your arm, wrap it around quite firmly, okay? And I just want you to relax your arm. There we go, okay. Just relax it down. I'm going to be pressing the stethoscope right into the crook of your arm here, okay? So. Okay, just release that a bit. Good. Okay. Okay, very good. I'm going to take the cuff off here. Okay. Looks good. All right, and I'm just going to be checking your oxygen levels here. So I've got a little clip here, and I'm just going to place it on your finger. Okay, we'll just let that sit for a moment. Okay, let me see that. All right, good. I'll take that off. Oxygen saturation is 98. Very good. So I'm going to be checking your temperature real quick. Okay, so I'm just going to be putting this underneath your tongue here. Very good. Now if you'd like to just let your tongue rest. Okay. All right, very good. Okay. 98.7, wonderful. And if I could just check your pulse real quick, do you have any preferences to what arm I do this with? Okay. All right, so just sit here for a little bit. Very good. Okay, so I'm going to pop on a pair of gloves here real quick, and then we're going to take a look at your head, eyes, ears, nose, and throat. So we're going to start in by, I'm going to check your head for any lumps, bumps, or inconsistencies, and I'm just going to check your hair and scalp. If I can figure out how to put the gloves on, of course. There we go. Wonderful. So I'm going to come in real close here, and I'm just going to be just palpating the head here. Everything's looking really good. Even hair growth all around. Nothing abnormal there. Wonderful. Good. Now I want to look at your ears. I'm going to look at the outsides of your ears, and then I'm going to get my otoscope and check on the insides, okay? I'm going to start with this side here. So I'm just going to come over to the side here, and I'm just going to take a look at your ears here. Just going to palpate around, looking for any irritants or swelling or lesions. I'm just going to check the back of your ears here. Very good. Okay. Alright. Take a look at the other side. Oh, here we go. Okay. So, lobe, the helix, tragus, antitragus. Looks good. Take a look at the back of the ear. Very good. Okay. No lesions, no swelling, no irritants. Alright, everything looks nice and pink. Okay, your ears look great. So now I'm going to get my otoscope out and just pop on a speculum. And then I'm going to take a look at the insides of your ears. Okay, the speculums have been sterilized. Don't need to worry about that. Okay, I got my light. I'm going to start on this side, okay? I'm just going to come over to the side here. And I'm going to pull up and back on the ear. And then I'm just going to insert the otoscope into the ear canal and take a look here. Ear canal looks free from obstructions, and tympanic membrane looks good. Nice pearly gray color. Okay, very good. I'm going to pull that out. Okay, I'm going to take a look at your other side here. Just going to be pulling up and back on the ear and inserting the ear canal, the otoscope into the ear canal. Gosh. Okay. Ear canal looks good and clear, and the tympanic membrane looks pearly gray. Okay, that looks good. Take the otoscope out. Okay, so while we're doing our head to toe assessment, I'm going to also be assessing the cranial nerves. So I'm going to assess cranial nerve 8, and I'm going to walk behind you and whisper some words into your ear, and I'm going to cover the other ear, and I just want you to repeat back to me the words that you hear, okay? Okay, So I'm going to walk behind you. Alright, I'm just going to cover one ear, whisper in the other. Matchstick, table, pencil. Okay, very good. I'm going to come to the other side. Cover one ear. Battery. Tape measure. Herbicide. Okay, very good. Come back around and take some notes. Okay, so we are going to assess cranial nerves 2, 3, 4, and 6. So firstly, I'm going to grab my Snellen chart. Our office doesn't allow for us to have them hanging on the wall. I've got these pictures hanging up instead. Whatever. So I'm going to grab a Snellen chart real quick, and I'm just going to have you take a look at it and read back to me what you see, okay? Take a look here. So I'm just going to have you read the line that I point to. Good. Good. We're going to jump a couple. Good. 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 And jump a couple more. Good. 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 Okay. That's wonderful. Just going to put that back. Alright. Okay. Now we are going to do the direct consensual response test. So I have misplaced my pen light, so we're going to use the otoscope, but all we need is a light, not a big deal. So I'm just going to be coming quite close to you. I'm going to put my hand up between your eyes, and I'm going to shine the light firstly in one eye to monitor the direct response, or your pupil should react to the light when I shine the light directly into it. And then your consensual response will be when I shine this light directly into this eye, for example. Your other eye should follow suit and react the same. That would be consensually reacting. Okay? So, I'm just going to put my hand up here. I'm just going to come in, direct, 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 good, consensual, consensual, consensual. Very good. I'm going to check for accommodation real quick. I want you to focus your eyes on the light here. Come in, good, go out. Come in, go out. Okay, very good. So now we're going to do a little test called the follow the finger or the H test. So I'm going to hold up my finger, and I want you to focus your eyes on the tip of my finger without moving your head. I want you to just follow my finger with only your eyes, okay? I'm going to stand back a little bit. Alright, just follow the tip of my finger. Follow the finger. Good. doing really well. Good. Up, down, side, side, up, down, side, the other side. Very good. And now up, down, up, down, up, and down. Very good. It's a little noisy in the neighborhood today, huh? It's beautiful weather out, I hear, so I imagine people want to get work done. Okay, now we're going to move on to your sense of smell, and we're going to test cranial nerve number 1. So I want you to close your eyes for me, and I'm going to have you smell something in this little jar. I want you to just tell me what it smells like. Here we go. Okay, peppermint, very good. Just going to pop on a fresh speculum, and I want to take a look inside your nose, okay? There we go. So I'm just going to be inserting the otoscope just barely inside your nostril. I want you to just tip your head back for me. I'm just going to look up into your nose. Very good. The other side. Very good. Okay. You can go ahead and bring your head back. And now we're going to move on to testing nerves 5 and 7. So I'm going to ask you to make some funny faces for me, okay? I want you to raise your eyebrows for me, okay? Squint your eyes real tight. Good. Can you puff out your cheeks for me? Good. Smile real big for me. Good. And I want you to just clench your jaw, and I'm just going to feel the muscles here. Okay. Clench. Unclench. Okay. Clench. And unclench. Good. So now to test cranial nerve 5, I'm going to do the soft, sharp test. I have a cotton wisp and a toothpick. So I'm just going to have you feel these real quick on the side of your jaw. So that is sharp, and this is soft, okay? So I'm just going to be poking these on different parts of your face. And I just want you to tell me if it's soft or sharp, okay? You close your eyes for me. Good. Soft. Sharp. Sharp. Soft. Soft. Sharp, sharp, soft, sharp, soft, sharp, sharp. Very good. Okay. Now I'm going to take a look at the inside of your mouth. you could just open your mouth for me real big and say ah. Okay, good. Gag reflex looks good. All right. Okay, can you stick your tongue out for me and wiggle it side to side? Okay, very good. And now we're going to check cranial nerve number 11. Can you just shrug your shoulders for me? Good. Now I'm going to put my hands on top of your shoulders. I want you to shrug them, even with me pushing down. Good. Okay. And now I'm going to have you turn your head side to side, but I'm going to be trying to resist you. Okay. I want you to try to keep going. Turn. Good. And turn. Good. Now I'm going to be palpating all along your jaw, your neck, your clavicle area, and I'm just going to be checking the lymph nodes, okay? So I'm just going to come in, just palpate lymph nodes here. Okay, it all looks good. I'm going to go behind you, and I'm going to put my hands on your neck. I'm going to ask you to swallow for me so I can check your thyroid, okay? Alright, can you go ahead and swallow for me? Okay, very good. Coming back around. So we're going to be assessing your respiratory system, your cardiac system, your abdomen, and we're going to take a look at your arms and legs. Okay, so now I'm going to be going around back again, and I'm going to be just feeling around on your back. I'm going to be percussing, taking a listen with my stethoscope, okay? Alright, I'll let you know what I'm doing so I don't surprise you. Alright, so I'm just going to be back here, and I'm just going to feel your back a bit. Okay, and now I'm going to be percussing on your back, alright? Good. Now I'm going to be percussing on your kidneys, and I want you to just tell me if it's tender, okay? Okay. Good. And now I'm going to put my hands on your back, and I want you to take a deep breath for me, okay? Deep breath in and out. Very good. Now I'm going to auscultate your lungs. So I'm going to put my stethoscope in, and I'm just going to have you take some deep breaths for me. I'll let you know, okay? Alright, deep breath in for me, and out. Deep breath in, 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 and out. Deep breath in and out. And deep breath in and out. Okay. Now I'm going to come to the front of you and I'm going to auscultate a bit here. There we go. Okay. Just want you to take a deep breath in for me. And out. Deep breath in. And out. Deep breath in. And out. And deep breath in. And out. Okay, very good. There's my pen. Okay. Now I'm going to be taking a listen into your carotid artery. So when I ask you to, I'm going to have you take a deep breath and hold it while I listen. And then I'll ask you to exhale, okay? So let's just start on this side here. Go ahead and turn your head to the side a bit. Good. Okay, take a deep breath and hold it. Okay, good. You can go ahead and exhale. And turn your head to the other side. Okay, deep breath in. Hold it. Okay, go ahead and exhale. Alright, sounds great. No pruies. Okay, now I'm going to take a listen to your heart, alright? Okay. So, I just want you to go ahead and take deep breaths. Okay. Just going to take a listen to the aortic valve. Okay. Pulmonic. Okay. Erb's point. Tricuspid. Reach around a little bit here. Okay. Listen to the mitral. Alright, very good. Now I'm just going to have you lie down and we're going to do a lot of those over again, okay? Right? Okay, so while I've got you lying down, I'm just going to have you turn your head. I'm just going to check for any JV. Okay, looks good. Alright, I'm going to take a listen to your valves again. Okay, just deep breaths. Aortic. Pulmonic. Erb's point. Tricuspid. And mitral. Okay, very good. Oh gosh, and I forgot to check your carotid artery. Still learning. My apologies. Okay, so just going to put this at the side of your neck here and take a deep breath in for me and hold it. Good. Okay, you can exhale. The other side, take a deep breath in for me and hold it. And exhale. Good. now I'm going to feel down your arms. I just want to check for any swelling or edema. Okay, color looks good. I'm going to be checking the capillary refill on each of your fingers here. Okay, all under 2 seconds. Great. And I'm just going to check for clubbing real quick. Okay, no clubbing. Good. Now I'm going to be checking on your legs, alright? Just palpating down. No edema or anything. Color looks good. Capillary refill. Okay, all good there, and no clubbing. Right, good. Hair growth's normal. Now I'm going to be checking your pulses on your arms, as I forgot to do that. So I'm going to be doing this bilaterally, be doing it at the same time. I'm going to check your brachial pulses here. Good. And your radial. Okay. I'm going to move down to your legs. So I'm going to feel on your feet your pedal pulse. Okay. Your post tib. Okay, very good. So now we're going to be doing an abdominal assessment. So I'm going to come down to your level and I'm just going to be checking the contours and looking for any pulsations, okay? Right, so I'm just going to come down here. Okay. Alright, all looks good there. I'm going to come back up. I'm going to take a listen to your abdomen, okay? Just breathe normally for me. Okay. Okay. Good. Good. Okay. Sounds normal. Active. So I'm going to percuss around on your tummy, okay? Very good. So now I'm going to palpate in quite a few different places. I'm going to do it first lightly, and then I'm going to be doing it quite firmly, okay? Alright, so I'm just going to palpate here. Good. Now I'm going to press in quite firmly, okay? Just let me know if anything's tender. Okay, very good. Okay, so I'm going to have you sit up and we're going to do a musculoskeletal exam and check on your reflexes, okay? So let me just go ahead and grab my reflex hammer. I will be back in just a jiff. Alright, reflex hammer armed. Okay, so now I'm going to have you just lift your chin up as much as you can. Okay? And then bring it down to your chest as far as you can. Good. To the side. Good. And the other side. Good. Okay. Now I'm going to be kind of moving your arm in different directions. I'm just going to be running and just checking the range of motion on your arms. Good. Okay, good. Can you pull your arms up and rotate your wrists for me? Very good. I'm going to try to pull you towards me. I want you to resist, okay? Okay, good. So I'm going to check your reflexes on your arms, okay? To do your triceps and your biceps and your brachioradialis, okay? So I'm just going to do triceps here. I'm just going to come in and tap, good, tap. All right, and the other side. Okay, and I'm going to check your biceps here. Good. And your brachioradialis. Good. Very good. Okay, so for your range of motion on your legs, I want you to lift your legs up and just roll your ankles for me. Okay, very good. Now I'm going to come down and I want you to just push your feet down on my hands here. Good. I want you to pull up. Okay, very good. So while I'm down here, I'm going to check on your reflexes. We're going to do the patella reflex, right? Your knee jerk. Good. Good. And check your Achilles here. Good. Good. And your Babinskis on your feet. Good. Okay, very good. Come up. Alright. Now we're going to have you stand up real quick. Okay? And I want you to close your eyes for me. I'm just going to assess your movement here. Okay, you can go ahead and open your eyes. If you could put your hands on your hips and twist from side to side for me. Okay, very good. Alright. Now take a look at your spine. I want you to bend over for me and touch your toes. Okay. Very good. You can come back up for me. Now lastly, I'm going to have you walk heel to toe forward, and then I'll let you know when you can come back, okay? Alright, just go ahead and walk heel to toe. Okay, you can stop and then come on back. Okay, very good. That concludes our head to toe assessment. Just going to take off my gloves real quick and take a few final notes. Wonderful. Do you have any questions for me at all? Okay, thank you so much for letting me practice this head-to-toe assessment on you. It was a pleasure working with you. I hope you have a whale of a day and a good rest of your night. Thank you. Bye now.
Thank you so much for watching. I really hope you enjoyed this video. Please like this video if you want to. Comment if you'd like to. Subscribe if you want to see more from me. And if you want to catch me on some socials, my Twitter is at Calliope Whisper with no S. My Instagram is at XX_Calliope. I'd like to give you a special thank you to my patrons on Patreon, for whom this wouldn't be possible, as well as the support